Lovely. So we have people slowly joining now, which is lovely to see. Welcome everybody who's joining. And if you're joining us, please, can you in the chat just introduce yourself, tell us where you're from. That would be really lovely. We always like to, after our events, always put a summary out of all the countries and the people who represented by those attending. It's really nice to see the spread of the work that we do and the conversations that we have. It's lovely. Um, we are expecting more people to be joining, as always. However, we have just the hour today, so we will get started slowly. And as people are popping in, we will give a little hello to them. So, welcome everyone to our Global Book Club. Which has been running now for over a year and is just such a lovely joyful part of the events that we have on, and it's an opportunity for our early career nurses and members to engage with authors who have written a book about nursing or is relevant to nursing. So we're delighted. This is part two of our first book club session that we had with Dr. Barbara Stilwell and her book that has launched recently, Global Health and Nursing, a New Narrative for the 21st Century. So welcome back, Barbara. Lovely to have you. For those who didn't attend the first one, it's available to watch on Nursing Now YouTube channel. Please do that because it is an opportunity to listen to the really thoughtful questions that our early career nurses, midwives were asking. It was a really deep and thoughtful discussion, and this is an opportunity for us to practice these engagements and have these conversations with wider group outside of nursing. You all have very thoughtful questions, and if you have them today, please put them in the chat for us. Also, if there's time, we will answer them at the end. If not, we will leave them with Barbara and she will respond and we will share them back with you. So nothing else to say here. I'm handing over to Barbara. Barbara, the floor is yours, and thank you so much again for joining us.
Well, thanks, Aisha, and thank you so much for the invitation. It was a great pleasure to be able to do the first book club. And as you say, we ended up with a really rich discussion. And I'm sure that this discussion is going to be extended into this one as well, which is great because that's why the book was written, really. And you contributed to it, Aisha, as did Zipporah, who is on the line as well. And you know, many authors contributed to this, and I think it's brilliant to have so many ideas, wrapped up tightly in this book. And I think it's a sort of it's a jumping off platform for discussions, which we saw in the first book club, and we will see in this one, I feel sure. So just a sort of quick overview, what does it do? What's it meant to do? As it says, it's meant to sort of bring old ideas together in a way that's forward-looking. So, you know, none of it here is things that we've never talked about before. But what we've tried to do in the book is to say, in this century coming, these are the things that are going to start rising to the surface, and that as a profession, we're going to have to look at. So the first of those really is all the systems that surround us. The planet, the economy, society, community. How do these systems affect nursing? And, you know, we could not have a better example of this than the dreaded Trump tariffs, which have sent shockwaves around the world and affected so many systems. So obviously, you know, the policies now being pursued in America are going to affect planetary health. The tariff war, as it's been called, has affected prices, the availability of goods, tourism, the ability of students to go to the USA and work in the USA, the ability of people to get jobs in the USA. So it's a really good example of how globalization means that if a butterfly flaps its wings in the USA, we all can hear it around the world. And, you know, I think it's really important that we, as nurses, as our profession, we recognize the sort of the way in which globalization, and there's a whole chapter on it in the book, the way in which it affects nursing. And the other thing about that is that we hear what's happening in the USA or in Ukraine or Gaza or Sudan within minutes of it happening. We are truly a connected world. And that really is the narrative of this book. We are connected as a world for good and for not so good. And, you know, social determinants of health, which is something nurses are always concerned about. So, in other words, the impact of all of these things on the people that we look after and on ourselves, they will all change for our communities. The climate, the food supply, what they can afford, all of those things, whether they've got work, what their education looks like, all of those things will change. And that's our business as nurses, and you know we need to be aware of it. So that's the first theme. The second is that nursing is the largest profession in the health workforce around the world and in every country. And it is also mainly women. Only 11% of the workforce are men globally. And the fact that it remains a mainly female workforce has implications for how we progress in our profession. Nursing remains low paid in most places, and all the literature, which we analysed in chapter 8 in the book on gender and nursing, shows that nursing remains a low paid profession in most places because it is a gendered profession and women do not get as much pay as men. And perhaps even more importantly, because it's mainly a female profession, it appears it's not as valued as male-dominated profession, or what are seen as more scientific, in inverted commas, professions. So nurses often feel undervalued while being overworked. And that's exactly why there's such a lengthy chapter on gender and nursing. The other thing to say is that nursing is not considered a STEM subject. Science, technology, education, engineering and maths is not considered in what's called STEM subjects. And that is ridiculous because nursing is a science-based profession. And that has implications. And the implications are it doesn't get the same amount of funding as other university STEM courses. And we're seeing in the UK some nursing courses actually being proposed to close them, which is incredible given the shortage of professions. And the third and final one I want to highlight is that we do have amazing opportunities as a profession in this connected world, which we saw in the original Nursing Now campaign, continued in the Nursing Now challenge, especially when we were working in the Nursing Now campaign, Aisha and I and Hannah, through the pandemic. We were able to share our stories on social media like this, you know, around the world. And the pandemic pushed us into using this more. So we were able to share innovation, perseverance, problems and how we overcame them. And it was inspiring. But more than that, it also gave us power as a profession. We connected and we were powerful. We could see the power that we held together. So those are the first, the sort of themes I want to highlight. I mean, obviously there's 12 chapters in the book and I'm not going to go, I haven't got time to go through all of them, but let me highlight those to get us going. And let me then ask Ruth to kick us off with your questions, Ruth.
Thank you, Barbara. It's an honor to be part of the panel that is asking you questions about this important book. And it's really a very important book in our nursing fraternity. And I just recommend everyone who is on the call that they should actually get this book and read it, because it highlights a number of things. So I just want to focus on chapter 5. I just want to focus on chapter 5 that talks about the nursing issues, nursing workforce issues during COVID-19. And this was a research that was done in different areas of the world to identify the issues that the nurses faced during that time, but also we find that the nurses are still facing almost the same issues at the moment. So my question would be, Dr. Barbara, in this chapter 5, there's a highlight on preparedness. And yeah, and we talked about preparedness as a key because as we looked at when we read through COVID-19 issues that happened, there was lack of preparedness during that time. So it highlights that preparedness is a key. However, we find that a number of us have knowledge. We have knowledge about the pandemics, the different epidemics. Currently in Uganda, we have Mpox, we have Ebola, and a number of times when those things come down, we forget. Then when they come, we panic. So we need to get into action as quickly as possible before the pandemic or an epidemic comes in. What would be the steps into action that we need to move out and do? We need to take our knowledge and come out as actions. We put in action what we have in knowledge. What advice would you give us, the nurses and maybe the management that we work for, in order to be prepared so that we don't panic every time we have these epidemics and pandemics in our different areas?
Thank you so much, Ruth. That's a really great question, because it's important, isn't it, that and we saw this in the pandemic, nurses know such a lot about infection control, about how to handle, PPE, how to work during the pandemic. They were innovative, creative, really stepped up, and yet they were not visible in many places. And, the surveys told us this. Nurses were not there to talk to the media. It was physicians, wasn't it? At least certainly in my country, and in other countries too, that nurses were acknowledged for the work that they did, but they were not at the, as it were, at the top tables. They were not there on the podium with the Prime Minister giving out the news of the day or talking about what they'd accomplished. And in many cases, nurses were harassed and badly treated because people in the communities thought they were bringing the infection back home with them. So already nurses are kind of on the wrong foot, aren't they, for action? And it's changing that, which is even bigger than the pandemic in a way. It's an attitude of society that I think we need to work on so that we can take our places as the team leaders in this. And as I said, earlier, I think that our power lies together in our joint, in our communal voice, the voices that we all share of the work we do. So I think, you know, one step, and I don't know how often this has been done, because we now see the pandemic in the rearview mirror, don't we? But in preparing, what's really important, or one of the important things, is to look and see what worked. So it's what we call sometimes in reflection, after action review. So what did we do that worked and what did we do that didn't work? And you don't only can talk about it and think about it, but capture it, write it down in steps. You know, these were things that worked, these were things that didn't. This is where we went wrong. So for example, one big example for nurses, we didn't have enough PPE. So my question would be, who in your country leads on ordering PPE and have they done it? And why, if you don't know, why don't you know? Because it's our business. And we have to be much more courageous, really, in holding both our politicians to account, but also our managers. So, you know, have you had your manager down to talk to the team and said, look, here's the things that went wrong in 2020 and 2021, and here's what we'd like to do about it. How can you help us to do that? So it's about getting into the habit of being able to identify what needs to be done and then looking around you for the way that it gets done. And I think quite often, because nursing is often absolutely, nurses are overwhelmed with the amount of work they have to do, that taking that step back and saying, now, how am I going to put this right, is actually it's a big ask to ask nurses to do that. But at the same time, nothing is going to change unless we make time to do that. And then we step up, we're courageous, we're brave, which I know we are. And we actually step up and say, I'll be the team lead. I'll lead this team because I know what has to be done. And just a little footnote to that. What we did discover was that in many sub-Saharan African countries which had tackled the treatments for HIV/AIDS as they came out and put systems in place to make sure those treatments got out to communities, their response to the pandemic was much, much better because they had than we countries who'd never done anything systematic. Also, you know, you have malaria outbreaks to which you respond. So practice is the key. And, you know, you've got that practice in with other outbreaks. What lessons can you take from that and apply to the next big pandemic? Dear God, I hope it doesn't come, but just in case. I hope that answers your question for now, Ruth. But yeah, Aisha, we can bring other people in.
Yes, for sure. If anyone's got
Thank you,
anything.
Dr. Barbara. That was very good. In fact, the key highlights that I are from the chat probably, but the highlights from the chat. Someone is saying that politicians and managers accountable for the things that they are doing. For need to have, because if it's not there, then we need to hold them accountable. And then someone else said that we need to let's be much more courageous in holding our politicians and managers accountable. That one I've seen. And then someone else is saying, I think it is important to encourage and support our early career nurses to give themselves permission to lead and appropriately change. What a powerful point.
Yes,
Yeah.
absolutely. Thank you, Ruth. That is a very powerful point, that, you know, leadership is not about seniority. Leadership should be in all of us everywhere. That's a really important point.
Yeah, and some of the highlights from what you said for me, what I took out was that we need to step out from our comfortable zones, and then we need to make it a habit whenever, so that we don't wait. We just make it a habit. If it's hand washing, let it be a habit. If it's social distancing, let it be a habit. If it's screening, let it be a habit, so that we don't wait for the pandemics or an epidemic to come in. So I picked such things, points from your answers. Thank you very much, Dr. Barbara. I'll give it to somebody, one of my other
Thank you,
colleagues.
Ruth.
Thank you,
Thank you, Ruth. I think we're now over to Joy. Thank you so much, Ruth. Joy, are you there to ask your question?
Yes, I'm here. This is Joy.
Hi, Joy.
Hello, Joy.
Thank you so much, Ruth. Thank you so much, Dr. Barbara. Joy Obialo, a nurse from Nigeria, currently working in northern Nigeria. So reading this, I just feels like my question relates back to Ruth's question, moving from hers to mine. I read the chapter, the 7th chapter, which talks about same nursing but different roles in the world and for the next century. Talking about how nursing is evolving, a lot of changes coming, and the concept of global health. I think something that caught my attention was the concept local, that's looking at global solutions, looking at both acting globally and locally. Can we look at the particular scenarios, global issues we have, but address it through local solutions? So I would like to ask a question. For looking at the future of nursing, are there particular competencies and skills that nurses need to build to not just be, to ensure that we be relevant in the phase of global health, just beyond, not just for now, but in the evolving era of like this century and even in the future? Are there particular skills that nurses need to have to be part of, from decision making, and when we talk about global health, from not just beyond what we have been taught from the past, but in the future? What skills do nurses need to be part of this?
Thank you so much, Joy. That's a great and complex question, I believe. And one of the part of the answer is what we were just talking about with Ruth, is that from the very first entry into the profession, nurses need to be socialized, professionally socialized, to be leaders, and not to stand back. But in order to be an effective leader, particularly in health, I think, we have a new imperative for nursing: to be in the know, to know what's going on in the world and how it's likely to affect our corner of the world. And then, being in the know, then be willing to comment when you can on what's actually going on. So part of that is just simply reading the newspaper every day. And I believe it would be very beneficial for nurses to have some skills and competencies and knowledge in politics and economics for the future. And nurses, sometimes have said to me in various things I've done, why do we need to know? What nurses don't need to know about economics and budgets, and why do we need to know about that? Honestly, health systems is usually the biggest expense that countries have, and the workforce is the biggest cost in the health system. And we're part of the workforce, and we should know where the money goes, how it's spent, and the value that the country gets for the work that we put in. And we're not used to thinking about nursing like that. It demands a different approach, I think, to the way we're educated, a more critical analysis approach to all the things that we do. So taking that approach in education, will be exciting, I think. It'll give us new skills, new ways of looking at the world, but it will also enable us to be something that we know for advanced practice and being a nurse consultant, that you have to have the skills of systems leadership. So if you're working, wherever you're working as a nurse, but particularly community nurses, you have to have an overview of all the systems that are going to impact on, you know, the work, the kind of work you do, the way that you do it, the way that you care for people. And so knowing that the patient you're caring for comes from a community where there's food insecurity is really important. And you need to understand why that, you know, why it's important to know about that system that's not working well. So social background, community background. If people don't have a supportive family, that's a really important system. So getting used to looking at all the systems, and these, you know, that includes the economic system, the political system, the social system, all of those things is really going to be increasingly important as the world really undergoes quite a lot of seismic shifts with planetary changes, with the wars that are going on, with globalization. We need to be really on top of all that. And in leadership terms, it's been likened to, instead of being on the dance floor doing the dance, we climb up onto the balcony where we can see the dance. And that's systems leadership. You can see what's going on and how all the parts are moving. And so teaching that skill, that aspect of leadership, it's called adaptive leadership. So teaching adaptive leadership to young nurses is really important. And then giving them a voice. So, you know, we don't traditionally teach nurses things like doing presentations, how to stand up and give a speech, how to speak in a crowded room. We need to do that. How to talk to the media, really important these days. We all need to learn to do those things. So there's a bucket full of skills. I'm sure there's some I've missed, but does that begin to answer your question, Joy?
Yes, it does. And I'm just like you said, nurses getting trained on leadership early in training, not just pushed into the system and then you have to learn by default. You don't learn. But if we could learn right from training, you're taught on leadership, you're taught on adaptive skills, your social skills, you're also taught on how to relate to others, especially politics. Yes, it's very important. And I see something we usually shy away from, but you've emphasized on that. Politics and economics too is crucial for nurses to learn those. And I think it's also talking about a shift in our curriculum, but I'll just leave it there.
Thanks,
I also wanted to like jump in here and also share that, you know, even as we are looking at ourselves as early career nurses, even like just learning the soft skills of networking, you know, as Barbara was saying, knowing the system, I think part of that is also knowing the players in that space, so that if you find yourself in the same space with them, then you're able to articulate your needs, you know, advocate for nurses, and also be able to engage at that level and even frame your, you know, issue or problem that is affecting your community. So things like, you know, networking, or like Joy was saying, socializing. I'm also thinking of, you know, engaging with your associations, because they know what's happening with nurses in your country. Aisha sometimes advises us to keep reading what the WHO is saying about, you know, workforce issues in our regions. Also the ICN is also like a good place to also get to learn what is going on in your country and possible solutions to apply at, you know, your local level wherever you are. Thank you.
Wonderful. Wonderful. Really, really great discussion, and some more questions in the chat, but I've been noting them down, but we're going to move to Mohammed next. Barbara.
Yes, Mohammed, please.
Well, good morning, good afternoon, everybody. Thank you so much for wonderful conversations that we had from the morning. So my name is Mohammed Mudbir. I'm a community health nurse from Sudan. So I had graduated back in 2020 from the University of Khartoum. and I had worked in Sudan in various positions, Ministry of Health, NGOs, and non-governmental organizations. Currently, I'm pursuing my Master of Public Health at University here in Sweden, and I have been assigned to read the wonderful chapter, which speak about chapter 12, which speak about the future of nursing in the 21st century. That was like a wonderful chapter that sum up all activities and outline the directions that our nursing professions are to evolve within the upcoming 25 years, as I mentioned, as I have read so far. So basically, the future of nursing is evolving, and the world is evolving with technologies, with professions, and everything that pop up with a lot of activities. So one of the things that has captured my attention when I'm reading that chapter is that the future of our nursing profession is evolving, and the focus would be around preventive care. That means that more nurses would be working in the primary healthcare in order to achieve sustainable developmental goals, and at the same time, in order to achieve the broader goal, which is we need leave no one behind and everyone should be in a health condition. So that's like quite an ambitious, transformative journey. And I'm wondering, with the current situation that majority of nurses working in the clinical practice, and their mindset currently focusing on the clinical practice. So if our future is going to be around primary healthcare centered approach, that required a lot of efforts of shifting mindset of nurses from just focusing on clinical practicing to primary healthcare. So this effort need a lot of disciplines need to come together, from community to faculty to creation of jobs and activities. So one point I would like to ask you about is how we could shift the focus of nurses from primary healthcare, from clinical practice into primary healthcare, and what type of recommendations that needed to be in place in order to achieve such a valuable mission. So back to you, Dr. Barbara.
Thank you, Mohammed. Thank you so much. It's a very important question because you're absolutely right. The future, well, I mean, it's very difficult, isn't it, to make predictions, especially when it involves the future. But it seems from those people that spend their sort of academic time looking at the possible futures of healthcare, that one of the things that's going to happen is that all healthcare is going to move away from facilities, so care in facilities, to care anywhere. And of course, there's an overriding reason for that, isn't there? And that is cost. It's very expensive. And those of you who have experienced care in, for example, in the UK, you very seldom get to stay overnight in a hospital because it's very expensive. So most people are discharged right away as soon as they possibly can be. So, for example, one of my friends had a hip replacement and she was home the next day, much to her surprise. But all her rehabilitation, was done at home. So care is going to move out of facilities to care anywhere. And we saw it in the pandemic. So we saw blood tests, tests for COVID-19 being done in car parks, didn't we? We saw consultations in shops, in the pharmacies, and we see that now. That's never gone away from here. Here in the UK, they've brought outpatient clinics out to clinics in the community. So it's one of the points that the Queen's Institute of Community Nursing is really focusing on at the moment. There are far more nurses working in the community than are being counted. And the thing about that is it's hugely complex. I mean, it's complex in hospital and it's very often very technically complex too. But that complexity and even the technical complexity does not go away in primary healthcare. And I think that is an important point, Mohammed, in your question. It's not either or, it's both and. So it's the clinical perspective and the preventive approach. So it's, making the work even more complex than it is. But it's why globally nursing is a best buy, because nurses are able to, their whole education is about making a connection with the person and looking at what's required for the care of that person within the framework of the relationship that you have with them. So if you have somebody who's had a heart attack, for example, and you're working on the cardiac ward, you're going to be very concerned with getting them physically better, saving their lives initially, getting them better, rehabilitating them. But then it moves to how do they not have another one? So then you start to talk, and it's the same nurse often will talk about diet, or we'll get the dietitian in and make sure the patient understands that, and talk about exercise and what they can and can't do, all of those things. So it's like a basket of care, which includes clinical, preventive care, and the future is going to look increasingly like that. The other thing that we know about future care is that we're probably, due to the work that's now being done on genetic analysis, we're going to be able to predict a lot more about what happens to people or what's likely to happen to people in the future. What are people going to do with that information? I mean, it's hard enough, isn't it, at the moment, with everybody looking it up on Google and thinking they're all, going to be dead by tomorrow. So we need to be able to help people manage that information. And that's yet another role in the complex world that nurses inhabit, and often inhabit without other people understanding the complexity of that. So the next thing we have to do is find ways to describe what we're doing, the complexity of what we're doing, which is the central plot of our story. So Mohammed, that was rather a long way around of answering that question. Does it come anywhere close?
Well, that's a wonderful conversation, Barbara. You highlighted that the future is going to be a complex between primary and clinical perspective, and then you highlighted the cost effectiveness of the intervention of discharging people in the long run, moving to preventive measures. That's like really, really very important thing. But more thing that this balancing between the dynamic between like clinical perspective and preventive approach require from us to feed our educational system to train nurses. You are not just going to work in a clinical setting, you need to work also in the primary healthcare. At the same time, create a reintroduction of nurses into primary healthcare, because in some systems globally, the nurses are not part of the leading the primary healthcare, the physicians who are leading the primary healthcare. And once you are a nurse, and I'm personally, I'm going to share this story, I'm a graduated as a community health nurse, which has been training in the primary healthcare, and I am supposed to work there. When I won't go there and work at the primary healthcare, no one is gonna accept me to my role as a community health nurse. And I guess what? I'm not like I have the educational system, but the other periods, the job rotation, even when I'm do like my registered nurse, I have supposed to be registered community health nurse, but I'm not registered as that. I'm just registered as a general nurse practitioner. I don't have scope of practice. So that means a lot of effort need to go and back and forth on that, not just focusing on the education. We need to prepare the work environment and work conditions for those community health nurses to work on the ground. So, you need to challenge the status quo of the existing systems. If you focus on clinical perspective, you are a nurse, you're supposed to work in a hospital. Why you need to work with the primary healthcare? So that's like the back and forth of challenging the status quo. So
yes, that's a very good point, Mohammed. I didn't address that. I think that's absolutely right. It's not only us that needs to think differently, is it? It's also society. And accepting. And here in the UK, it's always been accepted that nurses work in the community and in primary healthcare. And now, we have nurse practitioners in general practice, seeing patients. In fact, you're very lucky to get to see a doctor here at all. You mostly see a nurse practitioner if you're really lucky, or a healthcare assistant. So it's also about society and the messages that we give to people about the way they use the health sector. But then, as you rightly say, it's about the education of nurses. And here we did have a period where nurses started their education in the community. And Aisha, I don't know if that continued. did it? It was a few years ago now.
Yes, it did. But then when COVID came, it kind of threw everything up in the air. So we've had a period of about 4 years of nurses have been in education whose education was disrupted, and their placements there's maybe about 4 or 5 different pathways going on at the same time. But I absolutely agree, starting them off in the community more so now than ever, it needs to be where they are for a good part of their whole program. Now we have what I thought I'd do, because there's a couple of questions. So quick fire, thinking about the second questions coming from our nurses. This is just a quick fire, Barbara. So there's a comment about Catherine Mena is a nurse from Kenya. She's doing her MSc at King's, Burdett Fellow. That's funded by, these MSCs are funded by Burdett. She's just noting the difference in nurse education in the UK from other places. And then we also have Mutia, who is from Indonesia. And she said, considering the future changes in diverse countries like Indonesia, how can nurses be trained to provide culturally sensitive care that respects traditions, various ethnic groups? I guess that's really important with our diaspora, isn't it, also? So those were 2 comments. I know Baluku has his hand up, but I'm going to keep that. Baluku, if you could write your question in the chat, and Barbara, just maybe a couple of comments about nurse education, which is actually what you've just actually been talking about. So anything else to add there?
Yes, I actually, there's a very important point, and there is a chapter in this book on it, and that's about decolonizing nursing.
Yes.
I'm sure, Aisha, you're with me on this one, that, you know, we've not us particularly, but in the past, there's been an assumption that the curricula developed in the UK or America or, you know, wherever are the best, and they're not. And what's really required is for curricula to be developed by you in your country and responding to your culture, your cultural needs, your social determinants, your care needs. And that is a big ask. You know, we know it's not an easy thing to do, but it's a really good reason why, as Zipporah said, you should be working with networks. So, you know, you should know what your local school of nursing is teaching, and you should know who they are, so that you can work together with the School of Nursing Professional Association, even the chief nurse, hoping you have one, or senior nurses, and your practice regulators, so that there's a sort of, you can develop a curriculum that is for you, and you can look at your own scopes of practice and make sure they're suitable for what you want. And I know that is not a, you know, I'm not asking you to take out the trash here. It's a really difficult ask, but I think it's where the future is. I think, you know, having your own curriculum is really key.
Sorry, I'm muted. Okay, so we have only 15 minutes left. So for our wonderful panel, can you please you have your question, keep it very short, straight to the point, to deliver it to Barbara, because there's some great questions in the chat and we want to make sure that everyone else has. So please, if we can jump back to Ruth very quickly, your question, Ruth, and let's see if we can get through the 3 in top speed time. We might have to have another session at some point. Ruth, over to you.
Muted. Oh, thank you very much, Dr. Barbara, for all the insights.
Maybe Ruth is not there at the moment. Okay, so let's go to Joy then, if Ruth is having trouble.
Oh, look, Aisha, she's there.
She's there? Yeah. We can't hear her.
Can you hear me now?
Yes, thank you, Ruth. Okay.
So, thank you very much, Dr. Barbara, for highlighting the key points from the book that we have shared. Maybe my last question would be on workload and staffing in the healthcare system in the different areas of, especially here in Africa, where we have a number of schools getting out Schools are teaching more nurses, but again, we still have them in our hospitals. How can we be able to mitigate this problem? How can we be able to mitigate this problem? Because it's a big problem, most especially in our bigger hospitals here in Uganda. But I'm sure in the other countries, they are having the same issue.
Absolutely. Yes, thanks, Ruth. Yeah, really important question for nursing. And nursing is a globally sourced profession, as we all know. And if you go and look at the NHS here in the UK, there are people from all over the world working in our National Health Service. And we're very, without them, the health service would collapse here. And I think that's a critical point. This is really an area where we need to be aware of globalization. So the first thing is that in some countries, migration is going to be encouraged by the Ministry of Finance because it brings in remittances, the money that people send home, which is usually more than overseas aid, and it goes directly to families quite often. So it really makes a huge difference. So if you're standing in the Ministry of Finance, you might think migration is a good thing. If you're a person who's migrating, you might also see it as a good thing because it's an opportunity to seek maybe better paid work, different working conditions, different experiences, or an education, So if you're the person moving, you might think it's a really good thing. If you're the person in the workforce in the receiving country, you might also think it's a good thing. Because like I said with the NHS, without the people moving in, we wouldn't have a nursing workforce fit for purpose. So I think we have to be aware that where you're standing affects how you see migration. And the only way that we're going to change it is by giving nurses decent work so they don't want to move. So it's good enough to stay where you are. You're going to be valued, well paid, have decent work, have education opportunities. That's really, in the long run, one of the important ways of changing it. And the other one is that each country, like us in the UK, should be producing enough nurses to be self-sufficient. And we're not. And we're not because we know we can attract nurses from low-income areas. So it's a really good example of globalization and how, different levels of wealth in different countries will influence that, and the ability to migrate. So if you can get a visa, so for example, you won't be able to go to the USA now very easily, but people will be able to come to Europe. So, is that going to change migration flows? So being aware of those influences goes beyond just knowing and understanding what's happening. It really affects our profession. But if I have one message from this, it's take a look at the State of the World's Nursing that's coming out this year, 2025. Look at the progress that's been made. And if it isn't what you want or expect, hold your politicians accountable for that.
Brilliant. So, wonderful.
Is it back to?
It's Joy next.
Joy, yeah.
Okay, it's been an insightful discussion. So I'll be asking my last question. And talking about globalization, we know it has brought global health. Globalization has brought benefits, and we could also see the pros and the cons of it. From this chapter, from chapter 7, I have a question. Like when we re-examine we were talking about re-examining the power imbalances in global health partnerships. We're talking about low-income countries and middle-income countries. As nurses, young nurses, how can we contribute to young nurses in these low-income countries and middle-income countries? How can we contribute to shifting these dynamics in the imbalance? Sometimes when we talk about the power imbalance in global health partnerships? How can we put as young nurses in shifting, in creating an adjustment in this?
Thank you, Joy. So there's a saying which I'm sure you've come across, which I think is really important to this, and it is, bloom where you are planted. So we're not all going to be in the global decision-making tables, but wherever we are, we can look at the power that we have, the internal power, which is how we feel about ourselves as nurses, and the power that we have as a profession. So as we were saying earlier, you know, have you joined your professional association? This is step number one, isn't it? No matter which country you're in, because that will bring you together to look at the issues that are important for nursing and where you want to be. And that's the second step. It's what would I like to influence here? There are so many power imbalances in global health partnerships, but you know, one question to ask is, in those partnerships that exist between maybe your country and a country in the global north, for let's say, is nursing represented in those partnerships? Are you getting partnerships with nursing departments in other countries or nursing associations? And if not, why not? And is there a voice of nursing in the projects that are being done in partnership? You know, you are the people who can make that change in the future. And that's part of your evolving role, is to bloom where you are planted. Be the leader you can be today. It doesn't have to be in the future. Step up, be courageous, speak out. I know it's a difficult call, but
Wonderful.
do it.
Perfect. And finally, over to Mohammed, and then there's a lovely question from Baluka in the chat. Mohammed, over to you.
Well, thank you so much, Aisha and Dr. Barbara. I just wanted to pop that the point in the chat. It's a wonderful point that you have bringing up today, to have the mutual partnership benefit between global south and global north. That should be the key. So now I will end up to my last questions, which is related to the chapter 12, of course. I mean, like all reports that has been published from 2020, from the State of World Nursing Report, Sustain and Retain and Recover and Rebuild from the Nursing Now from the International Council of Nurses, has provided a detailed description of what needed to overcome such a nursing challenges that exist in the world, and put a lot of recommendations that require from global communities to work and local leaders to work. So I was just wondering why countries are not progressing despite they have the scientific evidence of those recommendations to tackle the nursing problems in today's world. And start another wondering if a nursing leader were in that position, has a claiming a seat at the policy table, that would make a difference, and how we can let nurses to be in a position to implement such recommendations that great for improvement of our nursing profession. So it's like a little bit about policy and bringing the power, because we have recommendations there. We have a lot of thousands of papers has been written about nursing workforce, about retentions and the importance and the effect of that, but we are not transforming those recommendations into actionable plans. So how we can move forward with
Yes. Well, you've hit on the $1 million question here, Mohammed, because we have so much evidence in nursing of our effectiveness, of our value for money, of our potential roles, our current roles, so much evidence. We could paper the house with it, and yet we don't. And it's almost like we're a bit too nice. You know, we just don't get our voices heard in policy, and we need to get much better at building that policy bridge. And one of the ways we can do it is by engaging with the media, to tell them our story and to tell them, you know, the evidence, what the evidence is, and relate it to policy that's going on. So in the UK, for example, they're trying to train thousands more GPs. Why not nurse practitioners? You know, so that's a message that's coming from nurses. Nurse practitioners can do this. Why are we waiting 10 years to get more GPs when we could have nurse practitioners in 2? It's ridiculous. So getting those messages out there is important, and being able to put your case in a crowded room where nurses are in the minority is critical, and it's difficult. So as I said it to answer to a previous question, practice, practice, practice. Get out there, get into those rooms and start saying what you need to say. It's not going to be perfect the first time, so do it again until it's absolutely perfect, till people turn and look at you and go, wow. And I know you can do it because look, you're all on this webinar.
Brilliant, fantastic. I love it. I love it. These are just amazing examples and things to really think about. All of you today, such great sound bites. It's like joy to hear Barbara talk like this, because it is actually frustrating for all of us, and for many of us who actually have experienced that change is possible, which we saw as the example Barbara gave of nursing now. That worked. That worked, absolutely. So Baluku, you had your hand up. Can you just unmic yourself, and you can ask Barbara your question yourself, if that's possible.
Thank you so much for giving me the opportunity.
Hi, Baluka.
I'm good, and you there?
Yes, very well, thank you.
I'm also very happy to be here. I'm very happy to be in this webinar, and it is really encouraging, very amazing, and it is really empowering us as nurses. Also focus on how best we can be able to impact our communities. Well, we are serving as nurses in all several communities where we are planted or where we reside. But we have always gotten a lot of resistances, basically now, like here in Uganda, where most communities are still like having issues to do with the culture. So it has always been a kind of a pull to go away from those cultural beliefs that maybe people are using, like maybe traditional herbs, to move from that to go back to this actually modern medicine, to see how best such can be brought on board. Because you realize that most people who are admitted in several lower hospitals, you realize that some of them they even visit hospitals after they have even tried herbal medicine that is just locally prepared, and maybe they have failed in it when they go for this modern medicine. So I'm wondering how really some of us, we can really move from being managed from health facilities to go to the primary health care in communities where someone can really concentrate on how to prevent infections and how they can really be able to live well in communities. It is really kind of tricky. I don't know how best we can handle such.
Yeah. You know, Baluka, I'm reminded of well, it was a little verse that when I worked in international development, which I did for 20 years, it was like a mantra for us, and it was this. It's ascribed to a Chinese philosopher. I don't know if that's true or not, but it says this: go to the people, live among them, learn from them, love them. Start with what they have and build on what they have and what they know. And of the best of you, they will say, we did it ourselves. There's a lot wrapped up in that, and if anybody wants it, I'll send it to you. But what it basically means is we have to go from where the person we're caring for is starting from. It's no good starting from where I am, because I'm in a completely different place. So I need to be, you know, where that person is starting from, what's important to them, what have they done so far, what's their story, and not be judging them. You know, that's their story. It's okay. Start with what they know and build on what they have. So it's perfectly okay then, you know, you're coming to a place where there's not a lot of clinical care, not a lot of technology, but you're building on what that person has. So where can you go from there together? What are they prepared to do? And what value is there in what they've done so far? You know, and we're now discovering a lot of traditional medicine actually does have value. So I know we don't have long, and I'm not going to say more, but if anybody wants that poem, let me know.
Yes, we all want it. We all want it. So if you send it to us, we'll send it out.
Okay.
Really, yes, thank you so much. I mean, this could go on and it should go on. These discussions must happen. So I guess I challenge you all to take these discussions out into your own communities, to your own group of nurses, and talk to them about this. Talk to them about the book. Tell them it exists. Get it on your reading lists in your universities. Get your organizations to buy it. Hold discussions like this, hold book clubs in your organization. The whole point of us doing this is we want you to have book clubs in your own settings to empower you to have these discussions and bring yourself together. Thank you to our wonderful panel of nurses who brought these amazing questions, and for our listeners, our watchers, our supporters in the chat. Some great discussion which I've saved. So we will send that on to Barbara and we will look through it and make sure that we can get back to you with your questions. We've put the link to the first one video, and you'll be able to watch this one again soon. Share it with everybody. This is the thing, we have these resources, we're having these discussions. Share them. Don't let it just be your little gift for the day. Let it be everyone else's gift. Barbara, such a joy. I'm sure we'll have you back. Because there's so much to talk about, and it's so lovely to be able to work with you again, and your knowledge and depth is just so needed today. So thank you very much, everybody, and thank you, Hannah, behind the scenes, who's always there helping us, and Martine. Take care, everyone. Have a lovely day, and keep talking.
Bye-bye.
Bye-bye, everyone. Bye. Thank you. Bye.